Phoebe came to see me because she'd noticed an asymmetry in her waist. One side of her waist was straight, and on the other side she felt her hip stuck out.
We actually noticed it when we were in Topshop and I was trying on a dress. My mum said that your back looks really weird. And then after that we went to the GP and they said it's just the way you're growing. And then we went again and they still said that. And then we went to an osteopath and she just took one look at me and was like, you've got scoliosis.
Adolescent idiopathic scoliosis is a condition which leads to curvatures developing in the spine as children go through their main growth spurt. This can vary from as young as 9 to as old as 17 or 18.
Once it had a medical name, then you start to a little bit feel alarmed. But when you get further into it and you see the specialists, they do put your mind at rest.
I explained to Phoebe a little bit about the different options that there were available to her. The curve that she had was too severe for managing any other way apart from an operation.
It was nice to have a name to it, like this is actually something something's gonna be done about it, and I'm not gonna be like this forever.
My role as a surgeon is to make sure that people are aware of all of the different options that there are that are suitable for their treatment, and for them to come to the correct decision for them rather than what I might want them to do or what their parents might want them to do.
He was very calm. When you get further down the road, he obviously has to tell you what could possibly go wrong, worst case scenario, and that for me was very difficult. But generally, no, he was very thorough, professional.
A few years later, while I was still following Phoebe's case up, Phoebe noticed that her sister had developed some asymmetry to her spine.
Phoebe actually noticed it in me, like one side was straight and the other side was curved.
It was already within a surgical range, and Gabriella was also keen on getting her curve straightened out.
I think Mr. Khan's only ever come across it once before, and they were twins, and it did feel a bit unlucky, but we had Phoebe's good experience of the operation to go on, so that did make it easier for Gabby. Well, for all of us, really.
We sort of first saw Dr. Khan in June, and then I had the operation in September of the same year. So it all happened really fast. But yeah, Dr. Khan was really supportive. He never made me feel like scared or anything. I always felt comfortable with what he was doing and what he was saying.
It went very smoothly. Phoebe did very well. She recovered very swiftly afterwards, and she had an outstanding result. She got her confidence back after her new back shape.
I was in intensive care when I came out, and that was quite difficult, but then Dr. Khan would come and he would just be like, oh, you're all right, and it was all like, he just made everything better, and the nurses were so nice.
Hearing about Phoebe talk about it, it made me feel a lot better about it, and when Mr. Khan was telling me what it would be like, I didn't really feel like I didn't want to have it. It didn't really make me feel like scared or anything.
Karen, the paediatric nurse at Leeds, was amazing. She was so comforting and friendly, and it was just having that friendly face all the time. My hips were straight away back in line. I grew 3 centimetres overnight because they just straightened me out, so I'd gone taller. So yeah, it was amazing.
Ideally, these operations need to be done when they're young. It's to do with the point they are in their growth cycle, which is why they were both done at a similar age. The Nuffield were outstanding. I did feel that it couldn't have been any nicer.
Gabriella had her operation. In some ways, she actually recovered slightly faster than Phoebe. I suspect that was because both Phoebe and Phoebe's parents had a bit more confidence in what they could and couldn't do after such a big operation.
I would do it again in a heartbeat. I just think it was the best decision to do it. I think it was the best place to have it done because I didn't even feel scared.
Literally the same faces for both girls. Nurses, physios, anaesthetists, surgeons. It made a big difference. I think they all changed their shifts to make sure that they have the continuity of care, and it did make a massive difference. I can't tell you how much it really did.
It's quite strange to think about that that's the thing we have in common, but it is quite nice.
I think it's brought me and my sister closer, because we used to argue quite a lot, and then obviously going through the same thing, neither of us know anyone else who's gone through it, so we sort of turned to each other, which was nice.